Assalamualaikum and greetings to everyone. Thank you to the organizer of the Faculty of Dentistry, Hasanuddin University, Makassar for the event International Conference on Biophysical Technology in Dentistry 5th. Let me introduce myself. My name is Fika Faradillah Drakel, Oral Medicine Residency Program, Faculty of Dentistry, Universitas Padjadjaran, Indonesia. Today, I will present a rare clinical manifestation of Pemphigus vulgaris in elderly patient, case report and literature review. First, I want to say thank you to Dr. Gigi Irna Sufiawati, Ph.D, Sp.PM consultant. Thank you for your guidance and support on this case report. I will start my presentation. As an introduction to my presentation, here's an explanation of the meaning of Pemphigus vulgaris. Pemphigus vulgaris, or PV, is an autoimmune disease in which Ig antibodies target desmosomal proteins to produce blister on the skin and mucosa. To what are the contributing and systemic conditions that triggers factors to the severity of Pemphigus vulgaris is: first is thyroid disease, type 1 diabetes mellitus, cardiovascular disease, and rheumatoid arthritis. This could be linked to the genetic condition and the role of genes. Of PV is 0.076 for 5 cases per 100,000 population per year, and adults between 40 to 60 years are more frequently affected. Objective of case report. This case report aims to describe a case of PV with unusual clinical manifestation with multiple risk factors in elderly patient. Get into the case discussion. The patient came to the Hasan Sadikin Hospital, Bandung. A 78-year-old woman was referred from the private hospital with a chief complaint of painful swelling in the lower lip for 3 months, processed by oral ulcers on the lip vermilion causing difficulty in eating, speaking, and swallowing. She had a medical history of rheumatoid arthritis for 5 years and routinely taking RA-related drugs. Oral examination revealed with a diffuse swelling on lower lip, desquamation surrounded by erythematous lesions with a yellowish crust, and saliva was drooling out. The NGT was inserted due to a limited mouth opening. Treatment consisted of the administering of sodium chloride 0.9% compressed to the lesions on the lip, chlorhexidine digluconate mouthwash 0.2%, nystatin oral suspension, oral acyclovir 400 mg 3 times daily, vitamin B12, and folic acid for a week. Dermatologist methylprednisolone 16 mg, betamethasone dipropionate 0.05%, gentamicin sulfate 0.1% in cream consistency, and cetirizine. The patient was also instructed to clean her teeth with a gauze moistened with sodium chloride 0.9% at least 3 times a day. Seen healing on the next control in the day 40. Swelling on the lips improved and the redness of the oral cavity decreased. In therapy discontinued, use nystatin oral suspension. Dermatologist methylprednisolone 8 mg, betamethasone dipropionate 0.05, and cetirizine. Stage of healing in the oral cavity. Healing to 62 days. Oral medicine. Hyaluronic acid mouthwash 0.12%, nystatin oral suspension, Kenalog oral base 0.1%, vitamin B12, and folic acid. Dermatologist methylprednisolone 8 mg. PV lesions are almost completely healed. The patient have no complaint of difficult to swallow and eating again. She is still under observation without any sign of relapse. Laboratory examination. We found that IgHIV1 test was reactive to 200 per U milliliter. You can see the left picture is a cone beam computed tomography interpretation. Figure A. Sagittal view show reassembling multiple radiocolon osteolytic lesions, partly well-defined and partly ill-defined, on the left and the right mandibular bodies. Figure B. The anterior alveolar bone in the mandible appears asymmetrical but cortical remains intact, possibly due to mass on the labial side. In the following figure, histopathological features of the specimen shows the suprabasal acantholysis. Based on the result of examination, a definitive diagnosis of PV was established. Go to the case discussion section. The swelling of the lips are a rare clinical feature of Pemphigus vulgaris. Therefore, we perform several laboratory examinations to identify the risk factor, to exclude the differential diagnosis, and to establish the definitive diagnosis. By some risk factor that related to PV in this case. The previous study and reports have been suggested that RA and HSV1 infection are the common risk factor of PV as seen in this case. The patient has history of RA for 5 years but did not routinely take penicillamine. She started taking RA drug routinely 6 months ago before the license appeared in her oral cavity. Hence, it was suggested that the effect of drug associated with the PV incidence in this case. This flow explanation illustrates the relationship between RA and PV, where the role is drug-induced syndrome multi-autoimmune. The association of PV and HSV is influenced by latent infection condition and the role of antigen-presenting cell, or APC, and activation of toll-like receptor, or TLR. HLA and DBR1 support the process of osteoclastogenesis, and drug-induced support the process acantholysis mucosa. Next explanation is pathogenesis Pemphigus vulgaris. DHG antigen can be activate CD4 plus and CD8 plus T cells. These autoreactive T cells can be identified even in healthy individuals and mainly produce IL-10 and EFNY. EFNY has potential to suppress DHG-specific T helper 2 or Th2 cell development. IL-10 is a key mediator of the peripheral tolerance mechanism that surpasses the activity of pathogenic Th2 cells. IL-10 has complex effect as it can promote immunoglobulin class switching to Ig4, the predominant subclass of anti-DHG antibodies, and has opposite effect in different phases of disease pathogenesis. IL-4 producing Th cell can be isolated from patients with pemphigus but not healthy individuals, and presumably drive anti-DHG antibody production from B cells. In Pemphigus vulgaris and Pemphigus foliacus is included by a humoral autoimmune response. DHG reactive or reactive to other epidermal autoantigens CD4 plus and CD8 plus T cells with cytotoxic activity can rarely be generated and mediate a cellular autoimmune response that cause interface dermatitis, which can be observed in paraneoplastic pemphigus, TCR cell, T cell receptor, TR1, and T regulatory type 1. The relationship between the drug induced of D-penicillamine plays a role in HLA type 2, where the process is supported by Th1 and Th2, causing an inflammatory reaction to osteolysis, resulting osteoclastogenesis, which causes chronic osteomyelitis and abscess in patient. HLA type 2 is also support the acantholysis mucosa, where the process is supported by T cell and B cell. This is also related to autoimmune reaction. Likewise, the association with multiple autoimmune syndrome is attributed to generic factors that are played by several types of HLA. The relationship between PV and HSV is also played by HLA type 2, so that the mucosal acantholysis. Now we jump up to the conclusion. Unusual clinical presentation of swelling on the lips challenging the early clinical diagnosis of PV in elderly patient with multiple risk factor. The second one is identification of risk factor of PV play an important role in establishing the definitive diagnosis and strategy for treatment. And the last one is appropriate laboratory test is related to the risk factor is mandatory to provide the patient to adequate treatment. And here are the references I used for this presentation. That's all for me. Thank you for your attention. I hope this presentation has given us new insight. Wassalamualaikum warahmatullahi wabarakatuh.